Diabetes is one of the fastest growing chronic diseases worldwide, affecting how the body regulates blood glucose. When left uncontrolled, diabetes can silently damage organs, nerves, and blood vessels. In this video, we'll clearly explain what diabetes is, its signs and symptoms, possible complications, and finally discuss scientifically supported vitamins and supplements that may help regulate blood glucose levels. Diabetes mellitus is a metabolic disorder characterized by chronically elevated blood glucose levels due to impaired insulin production, insulin action, or both. Insulin is a hormone produced by the pancreas that allows glucose to enter cells and be used for energy. When insulin is absent or ineffective, glucose builds up in the bloodstream. There are three main types of diabetes. Type 1 diabetes, caused by autoimmune destruction of insulin-producing cells. Type 2 diabetes, caused by insulin resistance and reduced insulin production. Gestational diabetes, which occurs during pregnancy. Early symptoms of diabetes often develop gradually and may go unnoticed. Common signs include frequent urination, excessive thirst, increased hunger, and unexplained weight loss. Other symptoms may include fatigue, blurred vision, slow wound healing, frequent infections, numbness or tingling in the hands and feet, and darkened skin folds, especially around the neck or armpits. Recognizing these symptoms early is critical for prevention of complications. If diabetes is poorly controlled, chronically high blood glucose damages blood vessels and nerves throughout the body. This can lead to serious complications such as heart disease, stroke, kidney failure, nerve damage known as neuropathy, eye damage or diabetic retinopathy, and increased risk of infections and amputations. Diabetes is also a leading cause of blindness, kidney failure, and cardiovascular disease worldwide. Lifestyle modification and prescribed medication remain the foundation of diabetes management. However, research shows certain vitamins and supplements may support blood glucose regulation by improving insulin sensitivity, reducing inflammation, and enhancing cellular glucose uptake. Let's explore the most well-studied options. Chromium is a trace mineral essential for insulin signaling. It enhances insulin sensitivity, allowing glucose to enter cells more efficiently. Studies suggest chromium supplementation may reduce fasting blood glucose and improve HbA1c levels in people with type 2 diabetes. Typical dose: 200 to 1,000 micrograms per day. Magnesium plays a critical role in glucose metabolism and insulin action. Low magnesium levels are common in people with diabetes and are linked to insulin resistance. Supplementation may improve insulin sensitivity and glucose control. Dose: 250 to 400 milligrams daily. Alpha-lipoic acid is a powerful antioxidant that improves glucose uptake and reduces oxidative stress. It is also widely used to relieve diabetic nerve pain, making it especially beneficial for patients with neuropathy. Dose: 300 to 600 milligrams per day. Cinnamon contains compounds that mimic insulin activity and enhance glucose transport into cells. Clinical studies show modest reductions in fasting blood glucose when cinnamon is used consistently. Dose: 500 to 1,000 milligrams standardized extract daily. Vitamin D is involved in insulin secretion and immune regulation. Deficiency is strongly associated with insulin resistance and type 2 diabetes. Correcting low vitamin D levels may support better glucose metabolism. Dose: 1,000 to 2,000 IU daily, or as prescribed. Berberine is one of the most researched natural compounds for blood glucose control. It reduces liver glucose production, improves insulin sensitivity, and activates AMPK, a key metabolic regulator. Dose: 500 milligrams, 2 to 3 times daily before meals. Although supplements can support blood sugar regulation, they should never replace prescribed medication or lifestyle changes. Always consult a healthcare professional before starting supplements, especially if you are diabetic or taking glucose-lowering drugs. With early diagnosis, proper management, and evidence-based support, diabetes complications can be significantly reduced.